So this little, like the banner that we put over the top there, it should hide us and like intro the episode. And
I
then as
got
soon
you.
as I remove it, I think our audio goes on and we both jump on screen. So I'll do it now. Hey everybody, it's Kevin and Thea. Excited to talk to you guys today with the Remote Care Services Show. Thea really came up with an interesting idea for the show today to talk about plugging care back into care management and how pharmacy can do it. The one thing I think we're going to try to weave in here is some concepts of the entire pharmacy team and how they can provide care. So stay tuned for a sec and we'll be right back. All right. So Thea, how are you? Catch me up on life. Is there anything that the audience should know that's going on in the world of Thea that they need to jump into?
Well, it's always crazy. It's always moving. I am on a healthcare journey right now of my own health. I am doing the thing, and so I'm navigating how to become healthy as a healthy adult in the many aspects of health, right? Like my
Yeah.
mental health, my spiritual health, my physical health, and recovering from a back injury that I sustained in 21.
Oh man.
It has been a struggle for me to remain healthy, and so I am on the journey. I am doing well and have lots of support. So, but that is kind of like the forefront right now with everything else I have going on with running a business and working full time and
Oh
kids.
yeah. Well, I mean, if you don't take care of yourself, I mean, it really ties into the episode, I think, quite well too. If you don't take care of yourself, all the rest of the things kind of fall apart or fall through the cracks, so to
Yeah.
speak. What are the things right now, Thea, you can advise to the rest of the crew that you kind of learned along the way of getting back to the healthy you want to be?
Yeah, I think it takes small actions. And I posted a few weeks ago about the little ladder and all of the little steps versus those giant big steps that you can take. We want giant quick results, but unfortunately it's the daily choices that I'm making and what I'm putting in my body. And the food has been a big issue for me because I have a lot of inflammation when I eat certain foods. And so I have a high inflammatory response to food. So I'm really trying to I've never been educated about food, so I'm learning. So take a minute to look at what you eat, and then the next morning how you feel. Here we are.
Well, I love it. And then we can tune into to Lauren Castle with functional medicine and turn into Marina for
Right,
herbalism and really
right,
get locked in step with that. So
yeah.
that's perfect. So speaking of locked in step, I think when it comes to care management and the stuff that we really care about, saying that pharmacists care, like sometimes it might not appear that way, to be perfectly maybe frank and a little brutal here. It may not appear that way, Thea, to someone that's coming into a pharmacy setting and thinking, I don't know if they care. Like they look like they're kind of heads down, grinding to get things done. I don't get a lot of time with them, those kinds of things. But we know from behind the curtain that most of us got into the profession to care, like to have those relationships, to cultivate that. But there seems to be a little bit of a conflict sometimes with what can be done and what can't be done. And then our mindsets on how we can kind of pivot things. So tell me, Thea, what you were thinking, I guess, on this episode in general to cover like how do we reinsert that care inside the pharmacy setting?
I think a lot of independents have an advantage here than necessarily some of the big box stores because they can pivot on a dime with how they treat their customers coming in the door and how we show up to care every day. And I can tell you job satisfaction kind of comes down to that too on the survey side of how pharmacists feel about their jobs. If they're allowed to care for their patients like they know how to, their job satisfaction is higher. And so, what do we mean about care? What is it about care that we show up to do every day as pharmacists and pharmacy technicians and the delivery drivers and the cash register personnel? It really comes down to meeting the patients where they are and helping them. That's our goal. Every prescription, every person coming into the pharmacy, if we have that goal in mind, it's really easy to satisfy that goal is because we have an opportunity to talk to the patient. We have an opportunity to make them feel better each and every day, each and every interaction. And with care management services, the whole show is around remote care management, care services. And, when we think of, most pharmacists think that it's a lot, but it really isn't. It really comes down to that core step of meeting the patient where they are. And I've said it over and over and over again that pharmacists innately have this ability to answer questions as soon as they come in. Like, we don't get a schedule of patients. We don't know who's coming in. We don't know what the conversations are going to be, but we innately know how to handle them. And it's probably years of practice, years of experience, but also like our education has kind of taught us how to do that. And so when we look at these care management services, I really feel like, you know, what we do in our daily lives as retail pharmacists, especially independents, we really get the opportunity to care on many levels. And it's not even just us. Like we were talking, it could be the delivery driver, it could be the technician, it could be the cash register personnel. It doesn't have to be just the pharmacist that's caring for those patients. So I think with regards to box stores, I think it's a little bit harder, but I still think there's opportunities that we may not take. Yes, it's going to back me up for a minute, but is it still the right thing to do? I say sometimes it is. My district manager may say something else, but when I'm not meeting those volumes, but when my patient satisfaction surveys come in, my patients are going to be happy because I was able to spend time with them.
Do you feel at times, Thea, is model part of the issue? You know, is it that we allow things just to happen on the fly? Like that's sometimes how we operate. Just you handle the fires as they come to you. You know, all you're doing is holding the hose and pointing, you know, as you go. Because I've seen a lot of information about appointment-based scheduling, like trying to have something that you're blocking out time that you're dedicating to given services, monitoring, et cetera, in the programs that you and I often talk about. But even for clinical services, having that appointment-based kind of mindset. So there's one question for you. Second one is, are we not leveraging the rest of our staff the right way to be able to help us to do so and to spread more? But take either one of those questions, either order you want.
I think the answer to both is yes. I think if you have the opportunity and you are the person that's doing the scheduling out blocks of time where it allows you to have patient engagement is huge. Just like you would do if it was a vaccine. People called all COVID asking for vaccines and you set them up with an appointment model. Why aren't you doing that now when there's questions or problems that you need to have addressed? Or your MTMs. Why can't you do that for your MTMs that you're already doing? Maybe. You know, why can't Mrs. Smith know that every, I don't know, 5th of every month you're going to call and see, are her meds changed? Have they changed? And does she see any changes so that you don't waste time pill packing and med syncing all of her meds for her? Like, why can't it be an appointment-based model? And why can't your technicians do that for you? There's nothing clinical there. It's asking questions. And when you get a question to your technician that they don't know the answer to or are not allowed to say based on your state's rules and guidelines, then that's when you get on the phone. But it doesn't have to be you as the pharmacist. It can be your support staff to help you along the way.
I love that. I mean, I think that the appointment-based model, like why did we adopt it? You mentioned COVID and vaccinations. So, I mean, we were seeing reimbursements go in one direction. We saw vaccines come in another direction and give us an opportunity to start making money, right? And so we said, we've got to do this efficiently and incorporate it into the model. Remote care services is no different. Like
not at all.
There's the parallel that we have the ability to say, we know we need to do this because this creates revenue. This drives cash flow in the appropriate direction for us. And we're going to block out time to say, this is what I'm doing all my remote care services monitoring each day, right? And we plug those things in. And the next step is really now, like you said, the triaging process of saying, and here's who's going to do that each day, right? Does it need to be? So let's do some examples. I guess I have something pulled up over here, Thea, that I'll kind of run through with you. It was a survey, and they were looking at the kind of the new roles that pharmacy technicians could take on inside of the pharmacy setting. And some of these apply so well to everything that we have to do inside of remote care services. So the top 3, even though I might argue that I don't feel comfortable with one of them, but the top 3 are taking medication histories, performing med reconciliations, and working with providers and insurance companies was number 4. I skipped number 3, which is preparing and dispensing medications. But just using 3 of those top 4, taking medication histories, performing reconciliations, and working with providers and insurance companies, I mean, all of those, those are the 3 main staples of doing any of the remote care services stuff that you and I have talked about now for months.
Yes.
And those are on the top 4 list of multiple websites in multiple organizations saying these are the roles that pharmacy technicians should play. Do you want to break any of those down for us there? Any ones that you want to jump into? The only one I want to comment on is it depends on what your definition of med reconciliation is,
Yes.
right? For that piece. So that's the
Yeah.
only one that I feel like is a little bit of a caveat if we're talking comparing internal lists versus external lists or making sure that we're reconciling everything across. Fantastic. If we're talking about making decisions with that reconciliation, right? Then there's the difference. But I
Yeah.
totally agree that we can gather a list just like we'd have done in a hospital setting that someone can
Yes.
do, right? The same thing you and I are used to of having a pharmacy technician go do a reconciliation consult with an individual patient, put that inside of the EHR, have that validated by a pharmacist, and then have that rocking and rolling. Of those 3 that I mentioned there, like any other things you're like, yes, like this is what you're already doing with your pharmacy technicians and pharmacies you're consulting with?
Yes. The answer is yes, yes, yes. Pharmacy technicians can do this. Your students can do this. There is nothing that says that they can't. And when you implement the proper procedures and have a template, those things are easy. You know what they're going to ask the questions. You know what data you're going to have when they're done. And when they don't do it, then you hold them accountable for it. Or if they overstep their bounds, then you hold them accountable for that. But there's really a ton of opportunity here to allow the programs to run without a lot of overhead from a pharmacist, pharmacist owner, a clinical pharmacist. And I say from a scheduling standpoint, when you look at what you're scheduling for the week, if you had an hour a day, and I know that's a lot for some pharmacies, but an hour a day to have a pharmacist and a tech looking at this data. So it doesn't have to be all the pharmacists. In between things, the pharmacist can be jumping on. But that hour of tech time could really be setting your care plans up for an amazing result that the pharmacist doesn't have to spend the time doing the care plan build, but they can just ask the questions that need to be asked on how the patient is doing. And then you will have satisfied the care plan for each of these services. And the pharmacist was not the one doing most of the lifting here. They're asking the pertinent questions, but they're not the ones doing the technical, time-consuming work. It's actually the person that's filling in the care plan. They're asking the questions on what medications do you take? Well, a technician can ask that question. It does not have to be a pharmacist. When you look at what you're going to recommend and what can be done about it, then that gets to the pharmacist. But much like an MTM, a lot of the work doesn't have to be done by the pharmacist. And I would venture a guess, in the pharmacies that I've seen MTMs really, really work, is the tech is doing the lifting and the pharmacist is coming in on the back end and managing the patient side, but not the data side. The data side is driven by the techs.
Yeah, I think it's funny we use the word tech because the first layer, like you and I know and have talked about before in other episodes, is the technology, right? Just allowing the technology to be appropriate and allow you to be as efficient as possible, triaging and flagging you to do the things you have to do.
Right.
The next step is all the documentation and other steps that are about entry components that can be done not only, I think, by a technician, a pharmacy technician, but better by a pharmacy technician. Their training, their skill sets often trump pharmacists when it comes to how efficient they can be in some of those processes.
Yes.
And I would leverage that skill set to the nth degree. I mean, they're just very, very, the folks that I've worked at, the locations I've worked at with technicians that are good at this are exceptional at this.
Right.
And so I think there's the next layer. And the next one is really, you get those processes to happen. It's no different than, let's use a hospital example, Thea. If we have a turnover of shift, we have one hospitalist or one internist handing off to another, what ends up happening that causes the most issue? Poor communication, right?
Yep.
We don't transition well. And so I think there's the documentation and everything that folks can work with people like you, Thea, to say, this is simple, this is easy, but making sure that data is flowing appropriately and getting to the pharmacist to make those decisions on what needs to be triaged to the provider, what needs to be recommended to the patient, what other documentation was missed. Those pieces are the ones that I feel like are intricate, and really require a little bit more experience, of going through, this is what didn't work and this is why it works better.
Yeah. And I would say that your order entry technician, who's probably been in their job for the last, I don't know, 10, 20 years in some pharmacies, if you rely on them to add data entry, they can do this care management side of things. If you're relying on a technician to call your patients who are in your MedSync program or you're in your pill pack programs, and they're asking those questions, you're already doing pieces of care management. Whether you call it chronic care management or if it's a piece of your remote patient monitoring program, that is outreach to the patient that you can get paid for your time. And you get paid lucratively enough that a pharmacist can do it. So what do you think the revenue is when you have a technician do it?
Yeah.
Threefold.
100%.
Huge difference in what that could look like. And, I keep getting questions around, is this a revenue stream that's sustainable? The answer to that question is yes. Because I just read a study the other day that said that Medicare is going to push so much into their preventative programs that they want every Medicare beneficiary in the country in ACO value care driven programs. Guess what's a value driven program, ladies and gentlemen? Chronic care management, remote patient monitoring, and all of the other acronyms that you could use around care management services. So if they want all of that to happen by the year 2030, that's 7 years. And why not be at the head of that? Why not have pharmacists helping drive that forward? Because Medicare spent billions of dollars in these programs over the last 3 years because telehealth picked up, right? And these are all telehealth driven. You don't have to see the patient in your pharmacy. You can be on the phone with them. And so they're throwing more money at this because they see the value and what it's doing with patient adherence to their medications, decreased ER utilization, decreased A1Cs and blood pressures, and all of the downhill or downstream effects of those things. So it really is a huge opportunity for pharmacists right now, in addition to our own circumstances of DIR fees are going to kill us all. So if we don't find revenue, then that isn't related to a dispensation of a prescription through an insurance company, then how are you going to keep your doors open? And if you have staff that are like, I don't want to do another thing, well, the option is to go work for big box. Help me do this so we keep independent, or maybe it's time for you to move along. All teams have to be playing on the same field, and all players have to be on the same team.
It'll change the way we hire, Thea, going forward. That will be a big shift between the kinds of individuals that are going to work in different situations and or settings will change based on what's happening in CMS, right? And keeping a feed on that. And I think that when it comes to the roles of dispensing, in general, not to beat on that same old drum that Kevin loves, but those roles of dispensing are going to shift to be able to see, here's the prioritizations happening from the payers, and they are asking for these types of roles to be filled with these types of skill sets. And therefore, we're going to have to be able to pivot to be able to take care of those things that are kind of needed. And you're right. I mean, there's a lot of legislation out there that are really looking toward, how do we improve primary care? How do we improve outpatient preventative services? And you're seeing it already by the reimbursements and the changes to Incident to billing laws inside of RTM and whatnot, showing that, yes, we want more clinical staff to be utilized that are non-physicians, inside of the space. I think one other plug is definitely, we have to go at the forefront of Incident to billing as much as possible if we expect our profession to be recognized as one of the major players to take advantage of these things. And talking to some insiders that have some information from CMS wants us to take that role. That's the expectation for us to jump into this space. They're already moving on MTM services. And so why not take advantage of some of the other Incident to billing services to push there? I know on RPH Ally side that we will be advocating for a lot of those things. Thea, you and I together, Jenna Quinn, Jaron Stout, some of those other folks that are all involved in just saying, here's where the future of the profession is. We have to make sure that we're pushing both on the legislation side and executing on our side to make sure we're getting those things done. So there's my soapbox, and I'll step down.
I love it.
You take the rest of the floor.
Yeah, I mean, I think you're right, Kevin. I think this is an opportunity to really show up for our communities and then payers will see the value of really what we're doing. And like I've said all along, when we try to move quality metrics and we try to make an impact on a patient's life, it's day to day. Just like I was talking about my own health, it's day to day. It's month over month that you're following up and establishing rapport and educating and taking small steps to make big gains at the end of the year. It is really the interaction that we know how to have month over month with our customers. That's what we do. And so, and it may not even get paid for it. At this point, we don't get paid for any of it. But what if you could? And you can. And, I think that there's a lot of opportunity for pharmacists who may work in a big box store that are unfulfilled because they can't care for their patients like they want to. There's opportunity there. What is your company doing around these care models? Because all of them are going to have to be driven around value, not volume.
Mm-hmm.
And so that's being pushed out there by CMS that says value is more important than the volume you're doing. And that's why we're seeing some of the bigger box stores shut down their pharmacies, because they know that they can't keep up the volumes. And so, when that happens, what is I don't know, what are the big box stores doing in their clinical services? Are they looking at this? Can you augment them? Can you use what you learn here in an RPH Ally to help augment your clinical team at your bigger box stores? Maybe they don't want to hear it, but maybe they do.
Well, I think that's definitely the case when you and I start looking at what have been the major mergers and acquisitions throughout all of healthcare. And some of those large employers of pharmacies have bought out some home health agencies and some primary care groups and others that are looking at having value-based services integrated with the pharmacy services that are being offered. So everybody's reading the tea leaves that are pretty transparent, if you're out there kind of looking around. And the next steps for us is just really going from talking about it to doing it. So if you guys are interested in talking about it to doing it, then Thea does have her Conquering Collaboration that's going on right now that you can jump into and get to learn more from her. She does independent consulting. She answers any of your questions on her RPH Ally channel to be able to jump in there. If you're another remote care services expert, jump in there too. Join the conversation with Thea and
Come
talk
on
about
in. I love it.
And we'll all kind of have a big happy family because the goal is just let's get more pharmacists doing this. Like this is the future of our profession. So we're excited about that. Thank you guys for joining. Any parting words, Thea, for the crew other than maybe how to pitch that softball just the right way?
Yeah, softball in my house is big right now. We just got out of hockey. Now it's softball, and woo, I got a month off. July is my month. Like that's it. That's the only month of the year I get. But yes, I think, just know that there's some people out here doing this. And if you have questions, you need to ask because action now is going to help save revenue in January and February of next year. So really have the time to carve out the time to make these clinical services work in whatever avenues you can. Are going to be important for those pharmacy owners, especially. So I'm here with questions and concerns. And if you just want to chat about how to do it, I'm here.
Awesome. And I know, Thea, you and I can jump on that over, but there are a few questions that got posted to us in the chat. So we'll jump in there afterwards. But thank you guys for all attending and for sending your questions. And we'll see you next time. Have a great rest of the day.
Take care.